Welcome to Evidence Based, a new Harbinger psychology podcast. We're your hosts, Cassie and Kendall.
On today's episode, we'll be talking about anxiety management with Dr. Joel Minden, author of Show Your Anxiety, Who's Boss. Dr. Minden is a licensed clinical psychologist specializing in cognitive behavior therapy for anxiety. He is a diplomate of the Academy of Cognitive Therapy, adjunct professor in the Department of Psychology at California State University, Chico, and author of the blog CBT and Me on psychologytoday.com. Thank you for joining us, Joel. We're really excited to do this interview, and I don't know if you've been doing, teletherapy during the pandemic, but this is obviously a really timely topic for us to talk about anxiety and some coping mechanisms and management. So we're very happy that you took the time to speak with us today.
Thank you for having me. It's my pleasure.
So why don't we just start off with an easy question of why is anxiety so difficult to manage?
Anxiety is difficult to manage because it's an uncomfortable emotion. And when we experience anxiety, it's hard to make sense of where it's coming from and why we're feeling that way and what we want to do about it. And I think most of us, when we feel anxious, we're dealing with a collection of experiences that can be pretty complex and confusing. So we might have physical sensations, we might have certain thoughts about the future, we might have urges to avoid or try to manage the anxiety. We might understand the experience in a certain way as something very extreme or dangerous or problematic. And then, as a result, we might have a very impulsive response to try to get away from what we think is a dangerous situation or to try to control the emotion. And unfortunately, we're not very good at either of those things, especially trying to control the emotion. And so when we grapple to reduce the intensity of anxiety, we find that our brain sort of pushes back. The anxiety might spike even more, and it's really frustrating and overwhelming. Excuse me. So I think that's one of the reasons that anxiety is so difficult to manage is because it doesn't always make sense when we experience it, and we're not very good at controlling or reducing it.
And so, kind of going off of that, because a lot of what it sounds like to do with anxiety is control, and you talk about anxiety, being a form of over control. Can you expand on that a little and why that makes it difficult to manage?
Yeah, so I like to make the distinction between anxiety, which is a normal emotion. It's something we all experience, at least from time to time, and an anxiety disorder, which I generally think of anxiety disorders collectively as problems of over control. And it's sometimes anxiety is a really helpful emotion because it's sort of a signal or a cue to action. It tells us that there's a problem or there's something coming up that might be really difficult or challenging, and it would be important to figure out a plan or do some problem solving so we're prepared. But anxiety becomes a problem of over control when we try to control the uncontrollable. We try to control how we think or how we feel. We try to control situations that are unpredictable or uncertain. And and then we get involved in this pattern of safety behaviors, the over control behaviors that are generally ineffective. And so when we think about anxiety disorders, there's always a pattern of distress or dysfunction or both. And with over control, when we try to control the uncontrollable, that's when the distress tends to escalate, the dysfunction tends to create more of an issue in the individual's life. And so I think it's really important to learn how to control what you can and let go of the things that you can't.
I had never actually quite heard of it as an over control problem in everything I had read about anxiety. And when I was reading your book, I highlighted that part that was like at the core of it, it's a over control issue. And I posted it on Instagram and like 7 people replied and were like, I feel seen, but also attacked. And I was like, that's actually, it makes a lot of sense. So to go off what you said about sort of what we try to do to naturally cope with these anxious thoughts or behaviors, what are some common ways that you see people trying to cope in these natural ways? Like what comes up for them naturally to try?
Well, I think the natural urge, there are kind of two typical responses that people turn to when they feel anxious. So one is avoidance. And I really think of, all sort of immediate responses to anxiety as forms of avoidance. But one would be avoidance, and that's pretty straightforward, where we might try to avoid a certain situation that's really anxiety provoking, that makes us uncomfortable. But it might be trying to avoid difficult thoughts. It might be trying to avoid the emotion itself. And sometimes people use tactics like distraction or even worrying as a form of avoidance, kind of moving from one concern to the next without really resolving much. So there's avoidance, and then there's emotion-driven behavior, and so sometimes that takes the form of trying to control or reduce the intensity of anxiety. Again, I think of that also as avoidance, but that might be something like, when people have social anxiety, they say, I feel better if I have a few drinks, a few cocktails, it helps me calm down, or I have to do my breathing exercises or take a walk around the block to relax a little bit. And so really kind of turning to these strategies or tactics to try to reduce the intensity of the emotion. I think typically that's what people do. Either they avoid what they can, or they attempt to, or they try to control the emotion itself.
Well, that makes a lot of sense too, because anxiety feels like something you want to avoid or try to step around for sure. But I know you mentioned some of the form or the types of avoidances. So, what are they officially? Like, the different types and how people apply those when they are avoiding their anxiety.
Some people follow a pattern of behavioral avoidance. Maybe they avoid certain situations. I can't go to class or to work or social events. I can't, certain um, certain contexts or situations that they tend to pull away from because the belief is that I'm just going to be too anxious. I can't do it. Some other examples would be driving or flying, things like that. So that's pretty straightforward. I think most people recognize the behavioral patterns of avoidance and how that impacts the quality of life because they distance themselves from things that might be really important or meaningful. There's also, the emotional avoidance, and that's where sort of the idea behind that is I can't have this feeling. I can't allow myself to feel anxious. People who might experience panic attacks, understandably, have this perspective sometimes that I can't feel anxious. It's going to escalate to the point where I hyperventilate. I'll lose control. Something awful might happen. I might have a medical issue. So working really hard to get away from the emotion, and that's where people might use, tactics like, so-called healthy responses. And these things are healthy when, they're used for stress management or just part of a healthy lifestyle, but maybe not as healthy to manage anxiety because they're so time consuming and not always effective. But things like, I got to exercise so I don't have to feel so anxious, or do my breathing, or, drugs and alcohol, right? This would be more destructive where the person's trying to get away from the feeling by turning to substances. And some people use medication, and certainly nothing wrong with making that choice to use medication to manage anxiety. But even then, we might think about medication as an attempt to try to avoid the discomfort of anxiety. And then there's cognitive avoidance, and that's where somebody might work really hard to get away from the distressing thoughts that come with anxiety. And so sometimes that takes the form of distraction, as I mentioned earlier, or worrying. And some people worry and they kind of go over and over the same idea repeatedly. They just revisit an upsetting thought and explore it from many different directions, and they never really resolve it, perhaps because they're wrapped up in the uncertainty of the future, the things they couldn't possibly predict or understand or control. Other people, their form of worry is more about, I worry about one thing and that's, really upsetting. So let me move on to another thing. And then that, also concerns me and I'm not able to resolve that. So we'll go to yet again something else. And then there's just sort of, I call it thought jumping. It's sort of this persistent pattern of moving from one worry to the next without really getting much out of the process. So all of these are forms of avoidance. And I think sometimes the worrying is the most subtle. Sometimes people aren't even aware that they're doing it. They just think, I have this idea. I find myself overthinking. And the next thing I know, 30 minutes have gone by or an hour, and I'm even more wound up than I was before.
Sure. Well, and kind of going back to the beginning of what you were saying about avoidance, where people who experience panic attacks and things like that kind of work themselves up to, staying away from certain activities that might trigger those things. I had kind of like a situational question or a follow-up question on that, as in, so how does someone find the balance of having like a real fear or a trigger to panic attacks, let's say like while they're driving, which then becomes a dangerous situation. How does someone balance that fear of knowing that they get panic attacks while they're driving without having that real anxiety become, an issue, like an actual issue of hurting someone or themselves, like in the car and not being able to manage it, but still getting to a place where they can drive and feel confident or not so anxious about it?
It's such a good question, and this is it's difficult to answer because everybody's so different. And I think that first of all, if we're really dealing with panic attacks, we're talking about something that is uh, uncomfortable, scary, inconvenient, but harmless.
Yeah.
Assuming that the individual is healthy, that they don't have medical conditions. So I guess, with that, I would want to know. I mean, if I'm working with somebody who experiences panic when they drive or they think about driving or the possibility of having a panic attack, first thing I would want to know is, is there any sort of medical risk? Is it possible that a medical condition might be important to consider and treat here before doing any sort of exposure-based work to try to get that person back into a car and driving, so they can really test out this hypothesis that I'm proposing, that panic or anxiety, they're just emotional experiences that are harmless. So there is that. So important to rule out, right, whether there's any sort of medical issue, or and then even aside from that, perhaps somebody had a prior experience where maybe they really felt like they were losing control, that they weren't able to drive the car effectively. They had a panic attack and they thought, I have to pull over. I have to, get somewhere safe before I can, get back into the car and drive effectively. So, I think it really depends on the person and the circumstances and the challenges that they're dealing with. But in a nutshell, I think assuming that there's no clear threat, it's very unlikely that the person would be in real danger if they get into a car. But it's just the idea, the possibility that panic will impact their driving performance that's so frightening. I think in a case like that, we might think about some sort of exposure hierarchy or something like that, where the person gradually moves toward getting in the car, driving the car a little bit, doing it early in the morning where people aren't around, driving a short distance, doing it where they might even recreate some of the physical sensations of panic, so that they really have an opportunity to see, what is it like to drive when I get anxious, when my body's reacting in this way that I don't like, that I don't want, that I don't want it to, I don't want these symptoms to be there. Can I deal with this? Can I cope? Can I work through it? Can I see for myself that this is uncomfortable, but it's just an emotion and it's tolerable and I can still drive? So I think those are the things that come through experience. That's how we learn. And so I think, depending on the person, it's certainly possible to work through that process so that someone really believes that, okay, now I'm ready and prepared to drive. Now, some people might say, I'm just not willing to accept that risk. This is
Sure.
something that it's just too scary for me, and I would prefer to rely on public transportation, get other people to drive for me. Maybe I'll drive a little bit where I know that it's safe, but I would never ask somebody to do something where they think it's just too high risk, or if I thought
Sure.
this seems like it's too high risk. But I think for most people, it's certainly possible to get to a point where they realize that this is safe. I'm not really in danger. My body's acting like I'm in danger, and maybe I can learn something new about this and my ability to cope.
So, kind of along with that, panic attacks aside, some of the physical sensations of anxiety, I'm thinking like heart palpitations, for example. and they're chronic. So how do you know when it's, just literally everyday anxiety that your body is like having these palpitations and sensations versus when you should go and see a doctor and get it checked out? Like how can you tell the difference when it is a chronic situation?
I always, if someone has somatic concerns like heart palpitations, I always say, go to your medical doctor, go to your primary care provider and get this checked out, right? Get the data, know for yourself whether this is something serious that really needs medical attention. Let's rule that out first. And sometimes, it's a process. Maybe their physician sees something, they get referred to a specialist. There's more, evaluative work, and so it might take a while to get to that point. But it's not for me to say this is safe, you're okay, you have nothing to worry about. I'm
Sure.
not a medical doctor, I'm not in that position. So I think it's important for the person, to figure out what do I need to know to be able to let go of this and treat it as anxiety and figure out how to work through it and cope. What information do I need so that I can, finally approach this differently? So going to the medical doctor, doing the evaluative work, I think is really important. Um, and then sometimes people, I've worked with clients who have a medical history, right? There is a risk. And so sometimes, maybe they've had a heart attack or something, and they continue to experience physical sensations that are confusing to them, where it's hard to make the distinction between, this is just my body doing what it does when I get anxious, compared to this is something that's really serious and I should get medical attention. So that's another thing to explore. What's the difference between the sensations, and when do you know that, or when do you think it's very likely that it's important to seek medical attention? So this is something where it might be important to collaborate with the physician, to get the person who's trying to make sense of anxiety versus a medical issue to figure out, okay, here's the line, right? Here's the point at which I can make one decision or another. And I think that's very freeing for a lot of people when they're able to say, okay, I know the difference between normal variations in the body and something that's really serious. So, that's something we look for. And then I think, in terms of, you brought up that point about, or the question about, chronic anxiety. So maybe there is no medical risk. Maybe, and I've had clients who tell me, I went to my doctor and they said, you have heart palpitations, but it's nothing serious. It's just something that some
Mhm.
people experience. You have nothing to be concerned about, but it still bothers them. It scares them. And so in those cases, we might work toward reappraising the physical sensations, toward understanding those somatic responses differently. So rather than there's a heart palpitation and that really triggers my concerns about an uncertain future, whether I'm really at risk here, and maybe this is something serious and scary, to looking at it as, okay, I have this automatic reaction, or I have this learned response where I understand these physical sensations as dangerous events, but I also know through experience that my body does this. I've been told through, from my physician that I don't have to be concerned about this, and I'm going to make a choice in this moment to accept it, leave it alone, and move on, redirect.
Do you have clients who feel or are very surprised by the fact that anxiety can manifest in those physical symptoms? I know for a lot of people, it's kind of like a light bulb moment to realize that stress or anxiety or panic can create so many different responses in your body physically. Is anyone ever surprised by that when you bring that up, like in therapy or when you're talking through their anxiety?
That's a good question. I think usually people who struggle with anxiety are very aware of what their bodies are doing when they get anxious, and that's one of the reasons they seek therapy. Why is this happening to me? Why does my body do this? But on the other hand, some people, they don't pay attention to the physical sensations because they're so wrapped up in their avoidance urges. How can I get away? That's all they're thinking about. Or they're so wrapped up in the worry, the cognitive element of anxiety, and they're not noticing the body so much. So, it varies. I think some people say, the only thing I'm noticing is what my body's doing. And for those folks, I try to help them pay more attention to what they're thinking. What's the threat? What are they anticipating that's so scary that might be driving those physical responses? But for other people who don't notice the sensations of anxiety, I try to link how they think, their subjective reports of anxiety, their avoidance urges, to what their body's doing. So I might ask the question, how do you know you're anxious? And that's a question I ask people a lot, because they say, I struggle with anxiety, and I want to know, right? How do you know that it's anxiety? Well, because my heart's beating this way, or because I can't stop worrying about, a bad thing that might happen. So I try to connect the dots. I try to explore with folks all of the different dimensions of anxiety, so that they can see that as one thing happens, so do the others. So I have, in my book, I use that acronym STUFF to talk about the four elements of emotion. STUFF with one F, STUF. S, sensations. T, thoughts. U, urges, avoidance urges. And then F, the feeling labels. How do you describe it, or how do you understand it? So I really try to put all those pieces together when I'm working with clients who have a tough time with anxiety, so that when they feel anxious, they can look at all of those factors and then make a decision about how to proceed.
I have kind of one more question about the somatic aspect. And this can be me, I can give a personal example. So my mom died from melanoma a couple years ago, 4 years ago almost. And I find that sometimes the somatic anxiety is very cyclical. Like every, March 11th, when I found out she was going to die, I feel it in my body for 3 weeks up until the date she died. Like, and I can almost count on it happening. Um, but if somebody is experiencing this sort of cyclical, like they can almost anticipate that they're going to feel this way. Do you have any tips for like, well, not avoiding it, but kind of just like being prepared for it, or, you know,
Coming to terms with it.
yeah, like
Yeah.
this is something that I'm always going to have to deal with, or, I can expect it and I can just remind myself that this is why it's happening. But I'm kind of fascinated with that because I find that it really is cyclical. Like I can almost count on it at the same time every year.
Yeah. First, I'm so sorry for your loss, and sorry to know that you kind of have those experiences, those emotional reactions at such predictable times. And I think that's how anxiety works. That there may be certain situations that kind of time of year, right, that might trigger um, patterns of thinking. And so anxiety is future oriented. So as you said, you anticipate that, I'm going to feel this way. My body's going to respond in this way. And when you make those predictions, when you believe that something bad is going to happen, then your body does react in that way. It's preparing for the threat. So, you can look at it as I try to really focus on relating differently to anxiety. And so instead of looking at the emotion itself as a problem, a bad thing, something that's dangerous, or that's going to really interfere with life, it can be helpful to understand anxiety in new, more realistic ways. So, for example, being more objective about the experience of anxiety. So this is just a feeling. It happens this time of year. It's something that I've learned to experience. It makes sense that this is happening. I expect it. I anticipate it. So, given the way I'm thinking, my prior experiences, yeah, I'm going to have this emotional reaction. Excuse me. So being objective, right? These are the thoughts that come up, or this is the emotional reaction that occurs, or this is what my body does when I'm reminded of an upsetting event, or when I anticipate that something bad will happen. So that can be really helpful. I think sometimes it's useful to understand anxiety as an internal annoyance, as it's unwanted, it's inconvenient, it is distracting, but to kind of look at it as something that you're not going to be able to fight, or if you do try to fight it, it's going to fight back. That it's something that maybe you just have to put up with for a while, right? Things get uncomfortable. Sometimes emotions are there for a reason. It's not a bad thing. It's not a problem, but it might be difficult. It might be uncomfortable. And maybe it's just an opportunity to work through an inconvenient annoyance. And I like to use comparisons for things like this. I think about, for example, as I'm talking with you right now, my cat is trying to walk on my keyboard, and I'm hoping that he won't disrupt this podcast. And so I think of anxiety as an annoyance, like my cat, right? Sometimes appearing, you can see him in the background now, sometimes appearing when I don't want him to. And, when I try to control him, he fights back, or he comes right back. And so anxiety works in the same way. It can be really annoying. But if we just accept that it's there and tolerate it rather than working against it, that can be really, really helpful. And then, using humor can sometimes be helpful. It depends on the circumstances. Obviously, if you're anxious about, something that's personally significant, something that's really meaningful or important in your life, maybe you don't want to use humor. But on the other hand, if you're anxious about something and you think you're kind of acknowledging that this is sort of related to kind of biased, irrational concerns, then it can be helpful to crack some jokes with yourself. And one of the things that I do, I'm not a very confident driver. And sometimes when I'm driving on really scary roads, I notice my own anxiety. And I think, I'm probably going to be okay if I drive slowly, if I'm really cautious. But my body isn't reacting that way. And I have these concerns. And sometimes I'll kind of, scream or sing the thoughts I have, I'm going to die. And, it seems so silly to me, right? It just gives me an opportunity to look at the anxiety in a new way and see it with humor, with some levity. I get a little bit of distance from it that way. And then I think self-compassion is really important, some warmth, and being able to look at anxiety and say, yeah, sometimes when I really get scared about something bad happening, even if I know that it's unrealistic, unlikely, I feel this way, and it's really, really hard. And I don't want to beat myself up. I want to be patient with myself. I want to be kind to myself. I want to respond with warmth and acceptance, just like I would do with a friend or a family member. I wouldn't tell other people, hey, what's wrong with you? You're feeling anxious, get over it, snap out of it. So why am I doing this to myself? Maybe I can just allow myself to have an authentic emotional experience, accept that that's what I'm dealing with right now, and go easy on myself. And I really like the mantra, accept and redirect. So accept the authentic emotion. It's okay. It's okay to have feelings. You're dealing with anxiety in the moment. It will decline. It will take care of itself. But do your best, right, to sort of let it live on in the background as you redirect your attention or redirect your behavior to whatever is more meaningful in the moment.
Well, if treating or coping with anxiety through humor is effective, then I must have a really, really good handle on it. That is my number one coping mechanism. Or
Self-deprecation.
Self-deprecation. Yeah,
Yep.
I was going to say I need the more self-love and acceptance. But kind of going back to the core of understanding anxiety in order to find the best way to approach it for yourself, in your book, you talk about 3 anxious beliefs. Could you expand on those?
Yes, when people get anxious, I think it's really important to pay attention to the thoughts, because anxiety is a future-oriented emotion. So, in a nutshell, anxiety emerges when we anticipate a threat and we believe we can't cope with it. So we overestimate the likelihood of danger or a major setback. We underestimate our ability to cope. So the 3 primary beliefs that tend to be present when people struggle with anxiety, or just anxiety in general, but really when people have a tough time with anxiety or meet the criteria for an anxiety disorder, number 1 would be probability overestimation. And that's where someone overestimates the likelihood that something bad will happen. So I'm going to go to this party and everyone's going to hate me. They're going to think I'm a loser. They're going to laugh at me as soon as I walk in the door. They're going to say, look at this guy. He's so anxious. He looks ridiculous. And they're going to tell me to leave. Sounds pretty unlikely, right? I mean, even if you're socially ineffective, most people are pretty patient. They give you a break, right? If you're not highly polished in social situations, but it could happen. But it sounds like, if somebody's thinking that way, that perhaps they're overestimating the likelihood that those things will happen. A similar trap, a sort of thinking bias that people experience and that gets in their way is catastrophizing. And that's the belief that not only will these bad things happen, really confident that they will, but they're going to be the worst. It's going to be the worst possible outcome, not just a bad event, but a catastrophic event.
Sure.
So, again, right, I'm going to go to the party, people won't like me, they'll laugh at me, but then the catastrophic part might be I'll never get invited to a party again, I'll lose all my friends, people will be embarrassed to know me. There will be, stuff on social media about, how poorly I handled myself at this party, things like that. Perhaps that's taken it too far. And then finally, inadequate coping, the belief that when these bad things happen, and they will, and when these catastrophic things happen, I can't handle it. I won't be able to do anything about it. I'm stuck. There's no hope for me. And of course, right, I'm sure you can see, right, if people think this way, then it might seem, well, I only have one option, and that's avoidance. Let me stay away from the dangerous situation, and then I'll be okay. So those are the biases in thinking. And to be fair, we all do this. We all get stuck on these ideas. And I think we have to remember that the trickiest thing about anxiety for many people is uncertainty. And so we just don't know for sure, right? People tell themselves things like, they think this way and they say, oh, come on, you're overreacting, or it's not going to be that bad, or everything will be fine. But we don't really know, do we? We don't have that certainty. And so that's why people get caught in these sort of overthinking processes, these sort of cycles of worry, because they think, awful things will happen. And then they try to reassure themselves, no, that's not going to happen. It'll be okay. And then they question that, well, are you sure? How do you know? And then, well, no, come on, let go of that. You're overreacting. Well, maybe you're not. And then back and forth, back and forth. So I think it's important to acknowledge that there is uncertainty and these bad things could happen and we may not be able to cope. And so that's why I think it's important to figure out, what can I do to increase the likelihood that these future events are successful, that I'm prepared, that I have a plan, that things will go well. And what can I do to accept uncertainty, to tolerate a reasonable amount of uncertainty, and go into these situations to take on these meaningful challenges with the understanding that I can't predict and control everything, and I'm willing to take that chance. I'm willing to see what happens. I've done enough. I've done what I can do. And now I'm willing to, get on with my life, and I'll deal with whatever happens. I think that's a really healthy balance, finding that nice middle ground.
So along with those beliefs, how in therapy practice do you validate those beliefs when it's coming from a very real thing like the pandemic, where we all actually have to avoid a lot of things, and emotional coping is maybe the only thing we have. So how do you validate that and work through that when it's like the only options seem to be avoiding and trying to figure out how to cope in your house emotionally and like block it out, or catastrophizing, right? Like it seems like everything in the real world is actually a catastrophe and it's like a hellscape and you can't go outside.
Or even like, okay, so we get, access to the vaccines. Like we finally feel like we don't need to avoid seeing people or going to the store. And then
Hmm.
another variant comes in, everyone's getting sick with the vaccine. Now, like trying to get over your anxious fears over the past year to go out and like re-enter society again, just to be told, no, you need to
You
go
have to go
back and
back in.
yeah, and kind of figure out that like avoidance pattern, while staying safe, but also not catastrophizing. Yeah.
hmm Well, getting back to that question about validation, I always validate, because who am I to say, right? That's irrational or that's biased, or I mean, again, we're dealing with a future that we can't predict. So I validate the concerns, right? It is scary. You do worry that these awful things might happen and that you won't be able to handle it, or whatever. So that's understandable, right? That you have these concerns. The question now, though, and the feelings that come with it, right? The emotional reaction. So the question now is, what do you do with that? Is it possible to explore that idea and maybe understand the situation in a different way, a way that is more realistic and useful? So, for example, if someone says, I can't go to the grocery store because, because of COVID, and I'm gonna die, right? If I do that, well, it's possible, right? And I'm not one to say that's not going to happen. You're overreacting. Go to the store. That could happen. So then, then the issue is, all right, let's think about what's realistic, what's likely to occur, and then let's think about what's useful, what's going to be a helpful plan that you can that you can create and then implement, so that you increase the likelihood that you're safe and you minimize the risk. So instead of trying to negate the catastrophic thinking, we might focus a little bit more on, well, what are you going to do about it? How are you going to handle this? So some people might say, well, I just, no matter what, I'm unwilling to go to the store and I'll get, groceries delivered. And other people might say, well, I'll go to the store, but, I need to get the mask going, and a certain kind of mask, and maintain my distance from other people. And even then, right, they might say, okay, well, I'm doing all I can do, but what about other people? I can't control what other people are doing. And so then it might be helpful to think about some assertiveness tactics, right? What are you going to say to people if they get too close, or if you see somebody who's doing risky things? What are you going to do in those situations? That might be an important thing to plan for. So, somebody who says, I can't go to the store, right, because these awful things will happen, maybe they're going to feel a little more prepared to go to the store if they say, I've got the mask, the right kind of mask. I know what I'm going to say to people. I know when I'm going to go, so there aren't as many people, or I've got a shopping list so I can get out of there quickly.
Mhm.
And then, like I was saying before, I'll tolerate the uncertainty, because there's a limit to the amount of avoidance, that I'm willing to employ in my life. And I need to get groceries. I'll take the risk. I'll just do it in the safest way possible. And if I get anxious, again, that compassion, it's okay. I have these feelings. It's to be expected. The important thing is I'm working through it. I'm doing what I need to do. So I always try to validate the inner experience. Yes, you think this way. Yes, you have these concerns. These feelings come with it. You have the avoidance urges, but let's think about being practical here. How are you going to handle this? And so, in my opinion, I think that can be really, really useful, because it increases a person's sense of personal control. I'm doing something here, right? I'm taking matters into my own hands. I have some influence. I have the potential to make a situation better for me. And it reduces that sense of helplessness and hopelessness. And I think that's huge in terms of mental health. And when people actually put themselves in important but challenging situations, they learn very useful things. So, what do you learn about anxiety when you take these risks? You learn that anxiety declines. Even if you don't do anything about anxiety, it's going to take care of itself. It will decline on its own. They learn that anxiety is tolerable. I can do these things. I can feel anxious. I can still do what I need to do. They learn that a certain amount of uncertainty is also tolerable, that I don't have to know everything. I don't have to be able to establish 100% certainty in my life. I can get on with things and tolerate a certain amount of uncertainty. And that's huge. If you can learn those three things about anxiety, then long term, it makes it so much easier to cope and go on with your life.
I just want to repeat something because I really like what you said about the amount of avoidance you're willing to put up with in your life, because I think that's really powerful, like your own limit of how much I'm willing to avoid. So I think that's really profound, and I just wanted to call that back out again.
Thank you. Yeah, it's not an all or nothing thing. It's not like, hey, you need to, figure out what to do because this is just anxiety and, go do whatever.
Right.
Right? Who am I to say that somebody is avoiding too much? It really comes down to the individual. You have to make your own decisions. At what point is anxiety controlling me and I'm not living a meaningful life? And how do I sort of change that script? So the title of my book, Show Your Anxiety Who's Boss, right? It's
Mhm.
that opportunity to say, yeah, I get anxious, right? That's a part of my life. It's a normal emotion. What am I going to do about it? How do I understand it? How do I respond to it? And so sometimes we'll make choices, right? There are certain things I'm just unwilling to do. Is it anxiety? Is it a safety thing? Is it a preference? Maybe it's not that important to figure out, right? Because sometimes we just say, I prefer or I choose to avoid, and I'm going to go with that and I'm okay with it. So ultimately, it comes down to the individual to make that decision. Do you look at this as a problem of avoidance that's interfering with the quality of your life? Or do you look at this as a choice that you're willing to make because you just prefer to do that? And I want to support people in the decisions that they make that they think are best for them.
I think it's really important going back to talking about validating and for you to say, who am I to say, but also giving coping strategies for, and I know we gave you a really complicated scenario, which we're currently living in to work through, which obviously we're taking notes on for ourselves. But I wanted to go back. So as we're going through and establishing some of the core ideas around anxiety that you talk about in your book, can you explain what an anxious fiction is? I know we kind of went through some of the scenarios that people who have anxiety play out in their head, but can you explain what the anxious fiction is and what are the consequences of those?
hmm Yeah, one of the sections in my book is about making useful predictions, not anxious fictions. I like those little rhymes. I think they're helpful for for remembering certain concepts. So again, when anxiety is a problem, there's a concern, there's a worry, there's a thought about the future, and so if somebody when somebody meets the criteria for an anxiety disorder, at least some of the time, it's very likely that their thinking has become very biased. It's perhaps distorted. The way they're understanding the future is really threat oriented. They're so focused on the possibility of a setback or the terrifying aspect of uncertainty that they just get stuck, and it really limits them because they're all in on this bias pattern of thinking. And so I look at that as something that might be an anxious fiction. It might be something that we tell ourselves that isn't really true, right? If we really kind of look at the idea, we might learn that okay, this is I am overstating the threat here. I am getting stuck on an idea that even I don't believe. I think a good example of this would be sometimes I ask new clients about the situations that are anxiety provoking. So when do you experience anxiety? And sometimes people will say all the time. And I don't want to say no, that's not true, right? It's not all the time, but I do question that, right? Is it an always thing, or is it often, right? More often than you would like, and there are certain situations, circumstances, events that seem to trigger the anxiety that make it more difficult to manage. So an anxious fiction might be something like, I'm always anxious. But if you believe that, if you really believe that to be true, what are you going to do about that, right? You're really stuck. If I'm always anxious, then there's no hope, right? Either I figure out a way to reduce it all the time, which I'm not very good at, human beings are not very good at, or I'm just going to have to live with, this persistent, pervasive anxiety. So useful predictions, right? Maybe we shift the thinking a little bit. Are there certain situations that tend to be anxiety provoking? What are those? What aspects of those situations make it more difficult for you? And so then the person might shift their thinking and say, yeah, I guess I'm not always anxious, but when I wake up in the morning, I think about all the stuff that I need to do for the day. And then my body responds. I feel very anxious and I get so overwhelmed. And then I have my coffee and I get even more anxious and I'm running off to work and I've got all this stuff in my mind about what I need to do. Okay, well, that's more specific. And so now that we understand the problem a little bit better, first thing in the morning, concerns about the workday or whatever, then we can move the anxious fiction from I'm always anxious to a useful prediction. And a useful prediction might be something that involves a plan. So if you know that you start your day like this, right, maybe one of the things you want to do is something relaxing to get your day going, or maybe you want to do a cognitive exercise to give yourself a little distance from the worries. I think writing is a wonderful process. So if you're waking up and you're thinking about all these bad things, write them all down. Right? What do you want to prioritize? What are the most important tasks of the day? What do you want to make sure you get done right away when you get to work? How are you going to approach it? What are the uncertainties that are maybe best left alone that get in your way where you spend too much time on these things and it just spikes the anxiety? Can you shift your thinking? So kind of to summarize, right? The anxious fiction, I'm always anxious. The useful prediction might be I'm anxious in the mornings when I wake up. I've got a lot of concerns about the day ahead. And so what's useful for me is to write everything down before I start my day. I get some clarity. I get some distance from my thoughts. I have a plan. And I know when I go to work, I'm going to be really effective because I have some structure. I have structure to my thinking and I have structure to my behavioral plan for the day. And I'm really much more prepared to take on everything that's in front of me. It's a much longer statement than I'm always anxious, but much more useful. So the anxious fictions, I think they drive intense emotions. They make it really difficult to function. And so we want to move the thinking toward the useful predictions that maybe reduce the intensity of the emotion, that create more options for maneuvering around the emotion, and that also include some useful plans for, as I said earlier, increasing that sense of personal control and making the individual feel more effective.
So I want to move a little bit more into some solution focused questions and talk about you have anti-anxiety mantras in your book, and specifically the do it anyway is one that you mention. Can you talk a little bit more about these mantras and maybe give some examples of how that might look in practice for someone trying to utilize them?
Sure. Do it anyway, I think is a great phrase to remember because, central to anxiety is the avoidance urge. So especially for people who have sort of a situational behavioral pattern of anxiety, if there's a tendency to avoid, I think it's important to change that pattern and replace avoidance with action, right? So I'm avoiding something that's important, something I care about, something that might be rewarding. I want to find a way to do it. I want to make it happen. So you got a choice. I think it's helpful to think about our lives in this way, especially for people who struggle with anxiety. We've got a choice. Either we can prioritize anxiety and distance ourselves from situations that we really care about because we think, I got to deal with anxiety first. I have to establish greater certainty. I have to control the emotion. I have to feel calm and relaxed. I have to be prepared. Then I can do things. So that's one way of operating. Or we can get on with things. We can say, all right, I've got certain things that I need to do or I want to do. They're important and I'm going to find a way to make it happen. The problem with that sounds so nice. The big problem is that when you take on these anxiety provoking challenges, you have to deal with anxiety. You have to relate differently to the anxiety so that you can still function. So that's a tough road. And so that's why we go through this process gradually. Do it anyway doesn't mean jump into something that you're unprepared for and do it in a big dramatic way where you really, where there's a really strong chance that you'll have a setback. Do it anyway means find a way to move forward, find a way to take action. Do the things you care about, do the things that are important. If you do it gradually, if you do it in a small way, but you do it consistently, that's how you learn, that's how you grow, and that's how you have a meaningful life. So, in my opinion, in my own life, one of the things that I found to be really useful is when I get anxious about something that's important. Maybe it's responding to an email response to a colleague, appearing on a podcast, uh, or media interview, or writing a paper, or having a difficult conversation with someone, or for me, right, even driving, right, can be anxiety provoking. When I feel anxious, right, one of the things that I tell myself is, well, you feel anxious because this is something you care about. You want it to go well. You wouldn't feel this way if it didn't matter. And instead of looking at the anxiety as a signal, as an indication that there really is a problem here and you better stay away, I look at the anxiety as a cue to action, right? It tells me this is important and let's figure out a way to move toward the important situation or behavior and be effective. How can I really prepare myself? And sometimes, preparation isn't going to pay off. We can over prepare. We can, that turns into a pattern of worry. And so sometimes, what I'll do is when I feel anxious, I'll notice the avoidance urge. And I say to myself, I'll even say this out loud, again, using humor. I'll say, and that's precisely why I'm going to do it. I'm anxious, and that's why I'm going to do it. I'm going to, accept this opportunity. I'm going to talk to this stranger. I'm going to do the difficult thing. I want to be able to do it. The anxiety is getting in my way. I accept the anxiety. I tell myself that's precisely why I'm going to take action here. And then I use that mantra, right? Do it anyway. So, I've done this so much that I don't even think about it. I just get anxious and I go, all right, I'm jumping in. And that's kind of, for most of my life, I was a very cautious person. And when I would feel anxious, I would, do more thinking and worrying and over control stuff, right, to feel prepared. And these days, I've really learned that when you feel anxious, just, move forward, do it anyway. So I think that's such an important thing. And in my opinion, the most important anxiety coping strategy is not how do I think about anxiety? How do I control anxiety? How do I reduce anxiety? The most important coping strategy is think about how do you take action so you can live your life? That's the most important thing. And then, right, that brings up the opportunity to figure out, well, what do I do with the anxiety that comes along? I always think about performing artists, people who they get on stage and they say, I feel like I'm going to have a panic attack every time, I get up there in front of an audience. And I've learned through experience that, that's just going to happen. But once I get going, once I start moving, I work through it and it goes fine. So that's such a great example. If you're a performing artist, right? I mean, that's your job. That's a meaningful thing. You want to be able to get on that stage. You really want to kind of share your art with people. If you feel anxious, it's important to understand it and relate differently to it so you can do what you need to do. So I think, that's a great example of do it anyway, right? For people who say, how could I possibly, do certain things when I'm anxious? Well, that takes practice. There's some trial and error. And that's why I think, a gradual approach can be really helpful. But as I said earlier, this is how you learn. And again, the three things that you learn, right, when you do it anyway, is anxiety declines, anxiety is tolerable, uncertainty is tolerable.
I like the idea that, if you keep repeating this mantra to yourself, that it can become second nature. I feel like that's a really good promise, like sort of fake it till you make it, like tell yourself you're going to do it anyway. And then at some point when you keep doing that, it's just what you do. Like that's your response. You're like, okay, let's just keep going. I think that that's really powerful and a really good, tactic.
Thank you. And I just want to comment on the fake it till you make it because I hear that a lot. And so just to kind of,
Oops.
well, I think that's it does sound like I'm saying that, right? Fake it till you make it, and to some degree that's true. But I look at it as a two-parter. right? You're faking the behavior, but it's authentic, right? It's something
Hmm.
that you want to do. So, there is a little bit of acting involved. It's, I'm going to approach this situation like maybe I'm not anxious because I'm trying to find a way to do it effectively. But you don't have to fake the emotional state, right?
Yeah.
And so I look at it as accept the anxiety, and then try to move forward behaviorally. Try to,
Yeah.
and that may require a little bit of acting, a little bit of faking. And so I, again, thinking about humor, right? Accept the anxiety. One of the things that I'll say to myself that, humor. I'll feel anxious and I go, feel the burn, right? Like you're working out, feel the burn, and I do feel it, and it's really uncomfortable, but then I still do it anyway. I look at it as the two-parter, right? Instead of fake it till you make it, engage in the behavior and accept the uncomfortable emotions. You don't have to fake how you feel, but you may have to work a little bit at figuring out how to function behaviorally in a
Right.
difficult situation.
How do we learn to accept our anxiety? What are some ways that we can come to terms with knowing it's going to be a part of our life, maybe not as significant or major as it always has been, but that it's there and it exists?
Hmm. Well, it's what you're saying. It's so logical. I think you could say that to someone, and they go, "Yeah, I know. I got to deal with anxiety." But I think the best way to really believe that is to live it, to experience it. And so, uh, you know, sometimes when I'm doing exposure-based work with clients, they might say, "Well, I'm not ready to do this thing because I don't want to feel anxious," or they say, I'm afraid, I think I can do this thing, but what am I going to do when I feel anxious? And how am I going to control it? And I always remind them that I want you to feel anxious, not because I want you to be uncomfortable, but because I want you to learn. And so when you do difficult things, you're probably going to feel anxious. So do them, right? Take a reasonable risk. It doesn't have to be a dramatic shift, but take a reasonable risk. Give yourself that chance to feel anxious. And then, right, then you see for yourself whether that's true. If I tell you anxiety is going to be a part of your life, you're going to have to learn how to deal with it, right? You go, yeah, whatever. But if you do it and then you feel anxious and then you go, yeah, I mean, I do tough stuff and I feel anxious, it's going to be a part of my life, but I can handle it. That's much more powerful. So I think work in the opposite direction. Instead of how do I think in a way that's going to help me cope with anxiety, the way I see it is start doing things that are anxiety provoking, not just because you want to feel anxious, but do the things you care about that are hard to do. Let yourself feel anxious and then learn something about anxiety. Yeah, it's going to be there. Yeah, it's uncomfortable. It gets in my way. It's distracting. I don't like it. I would like to control it, but I don't have to. I can let it be there. I can work through it. I can tolerate it. I can get on with things. So the best way to change your thinking about anxiety is to give yourself a chance to feel anxious. Then you get that opportunity for new learning.
And in other words, showing your anxiety who's boss.
That's right. That's right. Because otherwise, anxiety is the boss. But if you let yourself feel anxious and do what you want to do anyway, you're the boss.
Well, thank you so much for joining us. This has been a really fun hour, and we're excited to have spoken to you about anxiety.
Thank you for having me. It was great to talk with you.
In Show Your Anxiety Who's Boss, you'll find a practical and direct 3-step approach grounded in cognitive behavioral therapy to help you respond to anxious thoughts, respond effectively to future challenges, and make peace with uncertainty. If you're ready to live a full and vital life without anxiety constantly getting in the way, this straightforward guide will show you how to get back on track. Visit our website at www.newharbinger.com and use coupon code podcast25 to receive 25% off your entire order.
New Harbinger Publications is an independent, employee-owned publisher of books on psychology, health, spirituality, and personal growth. For nearly 50 years, our evidence-based self-help books and pioneering workbooks have helped readers make positive changes to improve mental health and well-being. Founded by psychologists Matthew McKay and Patrick Fanning, New Harbinger is proud to be an employee-owned company. Our books reflect our core values of integrity, sustainability, compassion, and trust. Written by leaders in the field and recommended by therapists worldwide, New Harbinger books are practical, accessible, and provide real tools for real change.
If you enjoyed today's episode, we'd love if you rated, reviewed, and subscribed to the show. And we hope you might share it with anyone who might benefit from the content. This podcast is not a substitute for counseling with a licensed provider.
Join the New Harbinger Clinicians Club, a free membership club exclusively for mental health professionals. Sign up today and you'll receive a special welcome gift, 35% off all professional books, free client resources, free ebooks throughout the year, access to private sales, a subscription to our Quick Tips for Therapists email program, and more. Visit newharbinger.com/clinicians-club for more information.